Hello everyone, my name is Cindy and I work at the Leon County Health Department, and today I'll be presenting on OSHA COVID-19 guidance on workplace. Some of the overviews that I'll be going over is talking about COVID-19, the purpose of this guidance, this OSHA guidance, what workers need to know about COVID-19, the roles of the employers and workers, and key measures for limiting the spread. So what do you guys need to know about COVID-19? COVID-19 is a highly infectious disease that is spread from person to person through particles produced when an infected person exhales, talks, vocalizes, sneezes, or coughs. It may be transmitted when people touch a contaminated object and then touch their eyes, nose, or mouth, although this is the least common way of transmission. COVID-19 is a highly transmissible and can be spread by people who have no symptoms and who do not know that they have the infection. Particles containing the virus can travel more than 6 feet, especially indoors. And the CDC estimates that about 50% of the recent spread of the virus is from individuals with no symptoms and at the time of spread. So the purpose of this webinar is to go over the OSHA guidance, which is the Occupational Safety and Health Administration. They prepared this guidance for planning purposes and for employers and workers to use this guidance in order for them to identify risks of being exposed to or to contracting COVID-19 in the workplace setting, and to determine the appropriate measures to implement. The guidance is not the standard or regulation. It is created and it creates no new legal obligation. It just contains recommendations as well as description on existing mandatory safety and health standards. The recommendations are advisory in nature, and the informational in the contents are intended to assist employers in recognizing and abating hazards likely to cause death or serious physical harm to their employers. So what workers need to know about COVID-19 and protections in the workplace? So the best way to protect yourself is to stay far enough away from other people so that you are not breathing in their particles produced by the infections, generally at least 6 feet apart, and that's 2 arms length apart, especially in enclosed spaces or those with poor ventilation. And then also practicing good hygiene and washing your hands often, always covering your mouth when you and nose with a tissue when you cough and sneeze, or using inside your elbows, but do not spit. Monitoring your health daily and being alert for COVID-19 symptoms such as fever, cough, shortness of breath, or other symptoms of COVID-19. Some other COVID-19 protections in the workplace is wearing face coverings, which are simple barriers to prevent your respiratory droplets or aerosols from reaching others. Not all face coverings are the same, so the CDC recommends that face coverings be made at least 2 layers of tightness woven breathable fabric, such as cotton, and should not have vents. The main function of wearing the face covering is to protect those around you in the case that you are infected but not showing symptoms, because some studies show that face coverings reduce the spraying of droplets when wearing over their nose. So it is very important that you wear those face coverings. You should wear the face covering even if you don't feel sick. It's very important. This is because people with COVID-19 who never develop symptoms are known as asymptomatic, and those are who are not yet showing symptoms, and pre-symptomatic can still spread the virus to other people. It is very important to wear face covering when you are unable to stay 6 feet apart for others, since COVID-19 spread mainly through people who are in close contact with one another. So wearing the face mask does not eliminate the need for physical distance or other controlling methods like washing your hands. It is important to wear face covering and remain physically distanced for coworkers and customers, even if you have been vaccinated, because it is not known at this time how the vaccination affects transmittability. Many employers have established COVID-19 prevention programs that include a number of important steps to keep workers safe. So include these steps from teleworking to flex schedules to personal protective equipment and face covering. So it's important to ask your employer about their plan for the workplace. The role of the employer and the worker in responding to COVID-19. So under the OSHA Act, employers are responsible for providing a safe and healthy workplace and free from recognized hazards likely to cause death or serious physical harm. So implementing a workplace COVID-19 program is the most effective way of mitigating the spread of COVID-19 in the workplace. So some of the steps that would be effective in preventing COVID-19 in the workplace there's a few of them. So the first one is assigning a workplace coordinator who will be responsible for COVID-19 issues on the employee's behalf. Another one is identifying where and how employers might be exposed to COVID-19 at the workplace. This includes through hazard assessments to identify potential workplace hazards related to COVID-19, identification of combination of measures that will limit the spread of COVID-19 in the workplace in the line with principles of hierarchy control. This includes a combination of eliminating the hazards, engineering controls, workplace administrative policies, personal protective equipment, and other measures that prioritize control from most of the least effective, and to protect workers from COVID-19 hazards. Another one is considering a protection for employees at high risk for several severe illness through supportive policies and practices. So older adults and people of age who have serious underlying medical conditions are higher risk for severe illness from COVID-19. So it's very important that you find mitigating strategies to recommend to those individuals, and where feasibility, employers should be considered responsible. Modifications for workers identified as high risk who can do all of their work at home part-time or either full-time. Another is 5, establishing a system for communicating effectively with workers and in a language they understand. So asking workers to report to their employer without fear of getting in trouble, or being able to report that they have symptoms and they'll be able to leave work early, or any possible exposure that they feel that they've had in the workplace. So communicating with your workers, to letting them know that they're comfortable and understanding the policies. Another is educating and training workers on your COVID-19 policies and procedures using accessibility formats in a language they understand. And that same is communicating supportive workplace policy clearly and frequently in plain language that the worker understands. Or in another, if you have, a worker that doesn't really speak the language, English, or they speak another language like Spanish, you'll be able to translate or have a translation of those policies. For 7, instructing workers who are infected or potentially infected to stay home and isolate or quarantine. This is to prevent or reduce the risk of transmission of COVID-19 within the workplace, and ensuring that the absence of policy and non-punitive, and policies that encourage workers to come to work sick or when they have been exposed is disfavored. So just to make sure that we're eliminating these hazards in the workplace. Also, minimizing the negative impact of quarantine and isolation on the worker when possible, allowing them to telework or work in an area isolated from others. If those are not possible, allowing workers to use paid sick leaves if available, or consider implementations of paid leave policies to reduce risk of everyone in their workplace. Some other preventative programs that could be implemented in the work is isolating workers who show symptoms at work. So workers who appear to have symptoms upon arriving at work, or who develop symptoms during their work shift, should immediately be separated from all the other workers, customers, or visitors, sent home, and encouraged to seek medical attention. 10, performing enhanced cleaning and disinfection after people with suspected or confirmed COVID-19 have been in the facility. This can include closing that area used by the potential infected person for enhanced cleaning, opening outside doors and windows to increase air circulation in the area, waiting as long as possible before cleaning or disinfecting. So 24 hours is optimal. Cleaning and disinfecting all immediate work areas and equipment used by the potential infected, such as office, workspaces, shared electronic equipment, tablets, touchscreens, keyboards, and remote control. Vacuuming the space if needing. Providing cleaning workers with disposable gloves or PPE, which entails safety glasses, goggles, and aprons while they're cleaning that area, and being able to disinfect the serving using the EPA registered disinfectants. And another recommendation is providing guidance on screening and testing. So following your state and local guidances that's provided by the local health department as to the priorities for screening or viral testing in the workplace. Testing in the workplace may be arranged through occupational health providers or consultant with your local health department. 12, recording and reporting COVID-19 infections and deaths. Employers are responsible for recording and related cases of COVID-19 illness and reporting to their local health department or whomever they need to report to. 13, implementing protection for retaliation and setting up anonymous process for workers to voice concern about the COVID-19. So providing a safe space for employees to feel safe and don't feel like they're doing something wrong about voicing their concerns. 14, making COVID-19 vaccine or vaccination series available at no cost to all eligible employees, providing information, training on benefits and safeties for the vaccination, and not distinguishing between workers who are vaccinated and those who are not. Workers who are vaccinated must continue to follow protective measures such as wearing face covering and remain physically distanced, because at this time, there's no evidence that the COVID-19 prevents transmission of the virus from person to person. So some key measures for limiting the spread. One of the key elements involved in eliminating hazards, which mean isolating workers who are infected or potentially infected so they cannot infect other workers. Most employees will follow a symptom-based strategy for identifying and separating and sending home workers. And one of the ways is workers who have or likely have COVID-19 should be isolated until they meet CDC guidelines for exiting isolation. And then workers should quarantine if they have been exposed to COVID-19. So for those workers who have or likely have COVID-19 should isolate it until they meet their CDC guidance for exiting isolation. Some of the protocols for that is if they think they know they have COVID-19 and had symptoms, they can return after at least 10 days since symptoms first appear and at least 24 hours with no fever, without fever reducing medication. Other symptoms of COVID-19 are improved, loss of taste, smell, may persist for weeks and months, and need not delay the end of the isolation. And B, some workers might need to stay home and isolate longer than 10 days as recommended by their health provider. So a healthcare provider may recommend that a worker have a severe illness from COVID-19. So staying in isolation for up to 20 days after symptoms appear. Workers who had COVID-19 or tested positive for COVID-19 and have a weak immune system should consult with their healthcare providers for more information. Workers, another one is workers should quarantine if they have been exposed to COVID-19, which means they were within 6 feet of someone who has COVID-19 for a total of 15 minutes or more within 24-hour period, starting from 2 days before the illness onset, or for asymptomatic patients 2 days prior to testing positive until the time the patient is isolated, or they can provide care at home for someone who is sick from COVID-19, or they had direct physical contact with a person who has COVID-19 from hugging or kissing them, or they share or eating or drinking utensils with a person who has COVID-19, or someone who has COVID-19 sneezing, coughing, or somehow got respiratory droplets on them. The local health department determines and establishes the quarantine options for their jurisdiction. So that would be Leon County Health Department here in Leon County. So the guidance says stay home for 14 days after the last contact with the person who has COVID-19. Watch for fevers of 104 degrees, coughing, shortness of breath, or other symptoms of COVID-19, which includes headache, runny nose, and some other ones. And to the extent possibly staying away from others, and especially people who are highly at risk for getting sick from COVID-19. So the CDC also recognized that local health departments may be considering others for ending other options for ending quarantine. So for example, ending quarantine after 10 days without testing, or after day 7 after receiving a negative test must occur on the 5th day or later. The CDC continues to recommend that individuals still quarantine for 14 days and recognize that any quarantine shorter than 14 days balance reduces burden against small possibilities of spread. Therefore, after stopping a quarantine of less than 14 days, the individual should watch for symptoms until the 14th day after their exposure, immediately self-isolate and contact their local health or health authority, or which is the health department, or healthcare providers. If symptoms appear, wear a face covering, stay 6 feet apart, and follow just the general mitigation strategies: washing your hand, avoiding big crowds, and taking a step away for prevent spread of COVID-19. Some other key measures for limiting spread include implementing physical distance in communal workspace. The best way to protect individuals is to stay far away so that as not to breathe in particles produced by infected persons, generally at least 6 feet apart, and wearing your mask. So limiting the number of people in one place at a given time. So implementing flexible work sites, implementing flexible work hours, delivering services remotely, implement flexible meetings and travel options, also increasing physical workspace if you're able to do that. And between workers at work sites, at least 6 feet apart, making them work 6 feet apart from each other. And between workers and customers, adjusting the flow by moving the electronic payment terminals or cashiers, providing making covering so that they'll be able to separate effectively. Another one is installing barriers where physical distance cannot be maintained. So at fixed, putting workstations where someone cannot social distance. So putting transparent shields or barriers like plexiglass or flexible strip curtains to prevent the spread. Also suppressing the spread of hazard using face covering. So providing your workers with face covering, and let it be cloth face covering or surgical masks or N95s, but making sure that you're providing your workers with those face coverings so that they can mitigate the spread. Improving the ventilation system in the office area or the area that the worker works. The CDC, they released the important guidance about the ways to improve ventilation and prevent the spread of COVID-19 in buildings. So that's one, you can find ways. So some of the ways are ensuring that ventilation systems are operating properly and provide acceptable indoor air qualities for current occupancy levels, increasing ventilation rates when possible, using fans to increase the effectiveness of open windows, disabling demand controls of ventilation systems, and there's some other ones. Also, you have using personal protective equipment when necessary. So making sure that the employees, your workers, are using the PPE when supplied to them, determining when it's necessary to use the PPE, and providing all PPE that's necessary, with let it being a respiratory N95 filter for the face, vents and valves, face shields, protective gowns and gloves, and this should be at no cost to the employees. And making sure that the PPEs are in accordance with OSHA standards, that's another important. And then also providing supplies necessary for good hygiene practices. So ensuring that workers and customers and visitors have supplies to clean their hands frequently, which can be, and cover their mouths when they cough or sneeze, and providing tissues and no contact trash cans, providing soap and warm water in the workplace, to fix touchless hand sanitizing stations, and providing workers with time to wash their hands with soap and water for at least 20 minutes before and after their shift, before and after their breaks, after they blow their nose, after they use the restroom, after putting or touching PPE or face covering, placing posters around the work facility to encourage the proper hygiene and physical distancing to stop the spread is another good way, and promoting personal health monitoring and good personal hygiene, including hand washing and good respiratory etiquettes, and performing these routine cleaning, disinfectants, probably every 2 weeks, but routinely, so that we can make sure that the workplace is stay clean and no germs are being spread. So that's all for the guidance. You can find the information on this slide on the OSHA website that I provided for this guidance. It was published January 29th, 2019. And thank you for listening. And this is the end of the webinar.